I'm Rebekah Pegram, Public Information Officer for Rockingham County. Today we are joined with Ms. Lisa Ellington with our Integrated Health. Tell me your role again.
So I'm now interim
Interim.
as local public health administrator, formerly with Integrated Healthcare.
Perfect. I apologize
That's
for that.
all right.
So we're sitting down today to talk a little bit about how we are addressing behavioral health needs in Rockingham County. We have already had a conversation with Ms. Dawn Sharapa with the Reidsville Area Foundation. There was a behavioral health assessment that took place over a span of several months, several partners, lots of collaborative effort to kind of address the gaps that we have in not just Rockingham County, but really everywhere, but specifically Rockingham County. So like I said, we've already had that conversation. Maybe go back and watch that video, because right now we're going to focus on what we're currently doing in Rockingham County, what we're going to do, what we can look forward to doing in Rockingham County based off the assessment. So like I said, I just kind of want to give it to you. Let's first talk a little bit about what we're doing in Rockingham County to address the behavioral health needs here.
Okay, so for a very long time, for several years now, we've had a post-overdose response team that many may not be aware of. And so since 2020, we had a collaboration with started out with Reidsville Police Department, Daymark Recovery Services Mobile Engagement, and with Integrated Healthcare's peer specialist and behavioral health counselor, in which we would respond to overdoses that occurred within the city of Reidsville. We would be notified by Reidsville Police, and we would go out just to do a welfare check, just to see how people are following the unintended overdose, and just to make sure that they're well, and to see if they're open to conversation about seeking treatment. We had about a 50% rate of actually making contact. Many people were transient in and out of our community, so we were not able to get in touch with everybody, but of those that we were able to get in touch with, of the 50% that we got in touch with, about another 50% actually were interested in talking to the peer specialists with Integrated Health, or seeking services through Daymark or through other agencies that we would connect them with. And so because of that success, Reidsville Police reached out to Eden Police Department, and so we started to respond in. We have a calendar that we would alternate when Daymark would be on call or when Integrated Health would be on call. And so we expanded that to the Eden City as well. And so that has gone well, and now we're looking at hopefully expanding it countywide. That is our hope. I think that we were trying to kind of take a let's wait and see what that looks like approach before we expanded it countywide. But I think that we're close to where we need to be, that we can start absorbing the whole entire county. That is our hope. And so that was one of the ways that we were trying to implement some harm reduction strategies, and we were trying to encourage people to get into treatment, because we're going to where they are, whether it's in their home, whether we have a designated place to meet, wherever that might look like, we're going to where they are and having real conversations with people. So we're hoping that we can build a rapport with people, and we can encourage them to seek treatment, and to find out if there are reasons why they're not going into treatment. What can we do to mitigate those reasons? So that's a strategy that we have had ongoing, that we're looking at expanding. The other piece is in EMS, they are not only carrying Narcan for the treatment of overdose, but they are distributing Narcan also in combination with public health initiatives. They're putting Narcan out in the community through our first responder agencies, through law enforcement, fire, police, EMS, rescue. There may be some in probably in our school system, probably in other community areas where the need has been identified as being a higher need for that level of care. So that's a harm reduction strategy as well that we have had in place for a number of years. Once we started to see an uptick of overdose, we started to do that. Some work that we are trying to expand. We do have a peer specialist and a behavioral health specialist in the integrated healthcare program that operates under Health and Human Services. We also have community paramedics. Now, primarily we had been focused on physical health care needs and any kind of service gaps. So with integrated health, you also had a social worker assigned to that. So it was a multidisciplinary team, so we could look at their gaps holistically, and so we could try to fill in those gaps with whatever service that was needed. And that program is expanding their service capacity to include what we call EMS Bridge, MAT. And MAT is an acronym that's used for medication-assisted treatment. And that's the treatment that is provided to those that are active in substance use that are looking for a way to find sobriety, but it prevents the withdrawal. So that is appealing to people because the withdrawal is so difficult. That is a reason that a lot of people do not seek treatment, is just because, or stop the addiction, is because the withdrawal is so severe. So it is debilitating. It is debilitating for many people. And so this is a program that they are fixing to launch. They've already received grant funding through the Division of Mental Health. And the community medics, as well as the peer and behavioral health specialists, will be going out to the people's homes to start initiating patient care for medication-assisted treatment. Now, the idea is that the peer specialist who's got lived experience can identify with them, talk to them on a level that they realize they can understand, and because they've been there, but try to connect them to resources for long-term treatment, because the community medics have a limited time frame that they can treat outside of a hospital, right? They can only treat for up to 7 days. So the idea is that they would treat for up to 7 days. Ideally, we'd like to keep it less than that, so that they could be treated by a long-term care provider, because this is sometimes it's months or years even to become stable in their sobriety. And so those professionals need to carry it from there, and that's what we want to do. We want to make sure that not only are they getting treatment for their substance use disorder, but they're also getting an opportunity for counseling for their behavioral health or underlying causes of their substance use. Other programming is we recently had funding that was made available to Daymark Recovery Services for behavioral health urgent care. It's the acronym for that is BHUC, so people may not identify with what that means, but that is an intervention that is to take some of the pressure off the emergency departments.
Gotcha.
So you have a lot of people that are coming in for treatment for mental illness and or substance use disorder, but this BHUC, they're referring it as a BHUC light, and that just simply means that you have a behavioral health urgent care in a large municipal city that has a lot of population, you have a much larger operation. We're a smaller county, and so we don't need that size operation. We need something more in line with the population that we serve. So it would make available, I think it's 5, they call them chairs, they're 23-hour chairs. So if people are in behavioral health crisis or in a substance use crisis, then that would be a place that they could go to initiate de-escalation for their behavioral health, or to decompress from their substance use disorder and then get connected to long-term care. So we're trying to take some of the pressure off from those emergency departments, and this is another place that they can go instead of taking those beds that should be available for other kinds of emergencies. So that's some work that's in play.
It sounds like we have a tremendous amount of stuff going on to alleviate the behavioral health crisis in Rockingham County.
We do, and making people aware of those resources is important. And one of the things that I would like to do in my new role is to make sure that I'm reaching as many people as possible that have an interest in this line of work. And so I want to encourage people to become part of our, we currently call it the Opioid Task Force, but we're looking at a name change so it's not so stigmatizing. But we meet the last Wednesday of every month. Currently, we're going to be meeting at the Emergency Services Building in the EMS training room. And that's at 150 Justice Center Drive for people who want to attend.
In Wentworth.
In Wentworth.
Behind the courthouse.
Yes.
Governmental, or not the governmental center. It's called the
Judicial Complex.
Judicial Complex, but it's behind the courthouse.
Yes. So we want to encourage people to attend. We want to reach anybody that has an interest. So there may be things going on in our community that's a grassroots type project. We want to encourage them to come to the table. We want everybody to have a voice. We want people to be creative in their ideas. And, you know, my role is a supportive role in that work. What can I do to help you be successful in the ideas that you have, trying to help them come to fruition? We do have opioid settlement funding that's available in the county. We do want to make sure that not only are we being financially responsible with those funds, but we're not duplicating efforts. So part of my role is to make sure that wherever those funds are being dispersed, and of course that takes votes from our Board of Commissioners, but wherever that funding is going to be allocated, we want to make sure we're not duplicating something because that may not be in the best interest of our overall funding.
Absolutely.
So we want it to be as broad as possible, but still be able to meet the needs. And so what we found out, not just through the behavioral health assessment, but through the opioid settlement, is there's a number of strategies. There's 12 different strategies. So it looks at a lot of different opportunities or focus areas within our community that funding can be used for. And so we want to give everybody the opportunity that meets one of those strategies to make a proposal, you know, create something that's going to be broadly utilized, not just in your community, but in the county, you know, to provide a service in the county. I know that Public Health recently got approved by the Board of Commissioners to do medication-assisted therapy. They call it MOUD, and that it's an acronym that's used to identify medication that's used for opioid use disorder. But they are now, the funding has been approved, but now comes the hard part, and that's the implementation. I mean, everything looks great on paper. It's been carefully thought out, but it's getting that into play, getting that implemented. So the work begins on that. Other conversations that I'm trying to get going is, you know, the jail has an interest in doing medication-assisted therapy for the incarcerated population. Currently, if somebody comes into the jail setting and they are already on medication-assisted therapy, then they are continuing that treatment, no different than if they were on blood pressure medicines or medicines for diabetes or any number of healthcare problems or behavioral health problems, then that would continue while they are incarcerated. Where the gap is you have folks that come in with substance use disorder that are not in a medication-assisted treatment program. And so we would like to see some programming develop where those individuals would have an opportunity while incarcerated to get treatment for their substance use disorder. And so, I mean, conversations with them about that and what their ideas are and the best way to implement a program such as that in the jail, I think that would be very important. Not only just for their substance use disorder, but what are we doing in terms of behavioral health in our incarcerated population. So we want to make sure that we're looking at opportunities to expand their program because there is an interest and there's a need, and we want to do what we can do to advocate for that.
Absolutely. The word that keeps sticking out in my head is expansion. So, I mean, obviously, you just heard all of the things that are going on in Rockingham County now for our behavioral health needs, any sort of intervention or harm reduction. I mean, there's a ton of stuff already going on. So it sounds like from you in this new position and the behavioral health assessment, it looks like you're just ready to expand those.
Right.
Trying to figure out how you can expand those opportunities. It doesn't sound like there's many things that we are missing, I guess, in the sense of what we found from the assessment to what we're already doing?
Well, to some degree, we do
Okay.
have. I would love to see some expansion in the prevention area. I would like to. I know that the school already has some programming. Honestly, I'm still learning about some of that programming, but I think that there's an opportunity to expand some programming in our school systems to address both substance use disorder and behavioral health needs. So I would love to see that expand. Mm-hmm. I would also love to see some programming developed that addresses an alternative for incarceration. Mm-hmm. So, incarceration is one piece of it, but is there an opportunity for us to get treatment for people for their mental health or for their substance use that may have been the underlying root cause of the behavior that got them into criminal trouble? Absolutely. So looking at opportunities for that would be something that I would love to see expand out. There's social determinants of health is also a huge thing. I think that DSS has lots of programming that addresses social determinants, which in lay terms just simply means, they have food insecurities, they have inadequate housing or lack of safe housing or affordable housing, or they have lacks in transportation.
Basic needs.
Just basic level needs.
I was going to say, you took the words right out of my mouth as far as the social determinants of health. A lot of it can stem from just people not having the basic needs.
Right.
Whether it's food, housing, transportation. We know that Rockingham County is a rural community. So to get from, Reidsville to Eden, that might take a 20-minute drive, right, depending on where you're starting and finishing from. And right, that's a ride. That's in a car. That's not.
And not everybody has a car.
Exactly.
And not everybody has a license or the ability to have insurance on a car. There's lots of, or even to put fuel in their car. So we do have public transportation, and I know that, it's affordable in the, $1, $3. That sounds affordable. For some people, that's a stretch.
It
even
is.
Still, or even with prescription assistance, $4 is a lot of money for somebody that doesn't have a lot for the whole month. So there's lots of opportunity, I think, to develop some scholarship opportunities or some special funding to help those people that they don't have the income, they don't have a means to pay for some of these things. I think our faith community, we've leaned hard on them. They have been fantastic. They've come out and they've developed, where either they're doing hot meals or they're doing, food boxes. There's lots of different programming that's through our faith community, and it's convenient because typically the people that attend those houses of faith are close to that house of faith, mm-hmm, so it's within walking distance and things like that. So I think even, when you're talking, even from an economic development standpoint, trying to build neighborhoods, mm-hmm, that are walkable if you're needing just to get to the drugstore or something like, or to a primary care, urgent care, that, yes, sort of thing. So you're seeing a lot of that develop. That's not any work that I've done, or I can't take credit for any of that stuff, but I think that it's important to think intentionally about how we do things and how they interconnect.
Absolutely.
So I would love to see how the community feels about what do they need. Mm-hmm. We think we know what they need, but we're not living in that community. So I think that this behavioral health assessment was truly important because they had a voice in it. They expressed, this is my reality. And I think it's important for us to see that.
I was going to say, there's a couple of things when I was doing my research, both just for this conversation, for the press release that I pushed out, there were some very, I don't want to say targeted because that's such a negative word, but there were very specific things that folks highlighted, like this is why they act a certain way, or this is what they would want to get them to into a better place or whatnot. Right. I won't get into those specifics, but it, like you said, it was really nice to hear from the people that experienced that I don't want to say lifestyle, but have that life experience to have their voice heard,
Right.
to make sure that they were a part of the conversation, make sure that we're not just, trying to make things better and not listen to the voices that are going to benefit from it.
Right.
So that was a wonderful thing. So as far as, I think we've touched on what we're doing now, what you hope to see, what you want to do in this new role. Are there any other thoughts before we move into like our next steps with this?
I just want to be open-minded.
Yeah.
I really do. I want to be open-minded. I want people's creativity to shine, and I want to support them in the best possible way to get the best possible outcome for the largest population that we can reach.
Gotcha.
Is really the end game.
Perfect. I wanted to touch on, before we close out, I wanted to touch on the current opioid task force. Hopefully that will be getting a new title to destigmatize.
That's on the agenda.
Yes,
that's
perfect.
on the agenda.
Yes, because that was something that the assessment said, is that destigmatization, normalizing and destigmatizing those words makes conversations easier, more available. It's less awkward, I guess, in a way. You have to have uncomfortable conversations to make change, but we start with that by making things more comfortable. So let's talk a little bit about that task force. When do you guys, and you mentioned it earlier, but when do you meet, what your goals are, how to be a part of that? Can the average person just
Absolutely.
Perfect. Let's expand on that a little bit.
So I mentioned that we meet the last Wednesday of every month. Wednesday may not be the best day, but that traditionally was when the meeting occurred. So I would like to explore what that might look like in the future. So I don't want to say this is going to be a forever thing.
Sure.
Anybody that has an interest can be part of the meeting. I just ask for people to come with positive attitudes, and let's come with the spirit of what can we do.
Sure.
Instead of playing blame type games. I want people to come in the spirit of, I'm here, I want to help, these are my ideas, and move forward. But if of that group we find that Wednesdays is not a good day, especially in our faith community, it may not be the best day to engage them. And so I've considered that maybe we can identify another day that works better for the larger group. And obviously we can't appeal to everybody's schedule, but we're going to try to be as accommodating as possible. We try to be respectful of people's time. So we try to adhere to the timeline and it's usually just an hour. So if people can spare an hour out of their very, very busy schedule, right now it's at 5:30. So we're not trying to make it super late,
Okay.
But at 5:30 to 6:30 is typically when we meet. A lot of the things that are on the agenda for this coming meeting are things that I've already highlighted as work that's ongoing. I do have an interest in trying to just talk about maybe development of an application process, so that if people do have ideas, then they have a mechanism to apply or submit a proposal.
And to be clear, an application not to join the task force, but an application to apply their ideas.
For opioid funding.
Gotcha.
So no, you don't have to apply to be part of the task force,
Perfect.
or whatever we decide to call ourselves.
Yes.
You don't have to apply for that. You can just show up, and so and we want to encourage that. But when you have money that's been allocated for a specific purpose, there are kind of rules of engagement on how we dispense that type of funding. And so I thought it would be prudent to develop an application process or a proposal process, so that if people have ideas or they're trying to get programming, whether it's part of an existing program and they're trying to expand from that, or just trying to maintain it, or if it's something just grassroots, I'd like for them to have a way to do that so it's fair and equitable.
Sure.
So that everybody, no matter whether they're a small community group or whether it's a large government agency or a treatment provider or something like that, I want everybody to have the opportunity to apply. and be heard. And really, it's based on how much work you put into it as to how well you're going to present your case for funding. And obviously, that goes to the Board of Commissioners. So we're trying to work through what that process might look like. So it's still too early. So I don't have like an announcement that this is go here and this is what you do. We don't have that yet, but that's what my hope is, that we have a place that I can say, if you're interested in applying for opioid settlement funding for a program that's part of the strategies that have been identified in the settlement, then this is what you do. We're not quite there yet, but that's coming up quickly.
Now, if anybody wanted to join this task force, how can they, but they have more questions, how can they reach out to you? Is there a specific spot on our website that they can go to?
Well, they can reach out to me. They can call my office, and that's at 336-342-8258, or they can reach me by email, and that's Ellington, ELLINGTON @co.rockingham.nc.us. And honestly, we're working on our website, so I'm hoping that we have current information on there, but honestly, I haven't looked at it since the holiday, so I'm not sure that everything's been updated. But that is on my list of things to do, is I want to make sure that we do have an opportunity on our website to get information out there, or links to other websites that provide information so that you can be made aware of certain things to look for, or you can get certain service providers, you can reach certain service providers. So we want to really beef that up and use any media opportunity that it's out there to kind of spread the word about where the resources are at. But just to start the conversation, they can call me, they can email me, or they can look to the website. They'll get in touch with me either way.
Well, and I was just about to say, if you guys at home have any questions about not only, the behavioral health assessment or what we're doing in Rockingham County as far as behavioral health and addressing those needs, feel free to reach out to me. I'm Rebekah Pegram, your Public Information Officer. You can reach me at 336-589-0967. Lisa, thank you so much for today. I've such enjoyed this conversation. It's wonderful to hear that things are happening, things are going on positively surrounding behavioral health, and this was just an expansion and hopefully a look towards the future.
Yes, thank you.
Perfect.
Appreciate it.